buzzy group of people here in the CCG.
We've got something really special.
We do right by our population, yeah.
The CCG in West Essex is absolutely fantastic. I think we have the best of any I've heard of.
It's an exciting time to be working in West Essex.
The NHS has actually always been built on people, and in 70 years it'll still be people.
The service I get from the GP practice in Epping is excellent.
Well, I think they're amazing. I think nurses are angels.
Everybody is there doing their job. They are concerned with your well-being and they need every support we can give them.
Nothing makes me more satisfied to actually help patients is what we're here for.
It's there when you need it. You know you're going to get help at the end of the day. I think it is a great service. It's kept me alive for years and years and years, and without it I really wouldn't be here.
The idea of CCGs is that the taxpayers' money for West Essex is located in our area, and our local doctors are in control of how that resource is spent.
West Essex CCG is a membership organisation. We're made up of constituent general practices within our patch.
We have a pot of money and we need to make that pot of money go as far as possible for our population.
CCGs are charged with buying the healthcare on behalf of the residents of West Essex.
West Essex CCG covers in the north, Saffron Walden and Uttlesford area, through Dunmow, down Stansted to Harlow area, and then down to Epping Forest Council, with our lowest area practices being Chigwell and Buckhurst Hill.
It is our role to plan healthcare for those residents.
What patients don't always see is that the NHS is a jigsaw puzzle, and you need every piece of that jigsaw puzzle to fit together to be able to have a complete picture.
I think the ambition for me would be that people out there see us all as one single organisation and one single NHS.
The NHS is there for patients. I mean, it's not there for any other purpose. It's to keep people healthy and well. So yeah, it absolutely should be patient-focused, I think.
Patients have got to be first, isn't it?
Patients are at the heart of what we're doing, and it's important that we're relating back to them.
When you meet staff here, you always get that feeling that they want to hear from people and they want to listen to stories.
We want to hear what people want, but we also want to hear the patient stories, where it's gone really well, where it's gone really bad, what they think we could do to improve the service.
Unless we plan the care around the individual and we understand what is important to that individual, we will definitely get it wrong.
So we do our best to engage the public at every step of the way, both operationally and strategically in terms of our planning. There are huge demands on the health service, so we have to be very, very careful how we spend that money. It is a big responsibility. Obviously, over the past couple of years, right across the public sector, money has been very, very tight.
It's really important that we get value from the NHS budgets that we have, and our philosophy is that the practices are best placed to know how to use those resources.
We've got quite a number of efficiencies in the pipeline. We are in a position where we can make changes. That's a good feeling.
A couple of years ago we went through quite a big listening exercise, and from that we were able to sort of invest in our strategy, which was all about integration from the very start.
Primary care is probably the most important aspect of what the CCG does.
I normally use my local GP on Pearls Lane. My local doctor's surgery is amazing.
General practice is the backbone of the NHS.
Secondary care is our biggest commissioning cost. So of the 400 million that we are responsible for of taxpayers' money, about half of that goes on acute care.
I don't like hospitals that much, but when I do, I find it really clean. I find the service astounding.
Any experience I've had with Princess Alexander's, anything A&E or operations and things like that, that's always been really positive.
These days it's not just what you would think of as mental health issues. Today's society is challenging.
We have a very local psychological therapy service for people with mild to moderate mental health conditions, and of course we've got good secondary care services provided by Essex Partnership for those people who are in much more need.
Children's side, as I have 2 children, amazing. I can get next day. So I can't fault them really there.
We've recently entered into a new procurement for children's services, but the feedback we're getting from families is that it's a really, really good service.
They're very speedy when it comes to getting appointments for children, which is good.
You can pop into a chemist and get advice from the pharmacists, which you never used to be able to.
Using the chemist is very important. They're trained to a very high standard. It also takes the pressure off your doctor. Do you need that appointment?
Your pharmacist is on the high street, they're easily accessible, you don't need to make an appointment. Why would you not go to your pharmacist before trying your GP?
I think there's a need to remind people more and more that actually if you want to book an appointment you can go online and do it.
You might assume that in the NHS, a lot of our patients and across the care system, that all of our records connect together, but they don't, and we're working really hard to achieve that through the My Care Record programme.
My Care Record is a way that a clinician, either in primary or secondary care, can see the records that other clinicians have recorded. And that's important for joined up workings.
We have developed an app which is called Health Help Now, which helps direct patients when they're looking for healthcare options.
So you can arrange appointments online, or perhaps even like web chat with the doctor if you could, rather than, especially if you're really sick and you can't get out of the house.
For our CCG, I'm very hopeful. We're trying to integrate services. We're trying to change some of the old ways of working.
I'm an advanced paramedic, which means I work as a paramedic and do 999 calls, but this service now, we've trained people to an advanced clinical level, which means they can treat people in their home. A RISCAR is short for Rapid Intervention Service. This is a completely new service. It's the first of its kind. It's been so successful now that it's going to roll out to other areas in West Essex. This is massive for the NHS. It's revolutionary in the thinking that we can now actually send clinicians out on ambulances and cars to treat the patient at home. It's been shown to make an average saving of over £1 million for the NHS.
We now have pharmacists attached to each of our care homes and each of our neighbourhood areas, and that means that they can proactively go out to the homes and look at the complicated multiple medicines that patients might be on and make recommendations to the GP.
The care home team have done great work in the reviews that they've done with patients, and they've stopped medicines that contribute to falls or medicines that actually are more harmful than beneficial.
We have seen some good improvements. What we have to make sure is that we don't rest on our laurels. We need to keep thinking further ahead and further ahead to continue to think to the future.
We have a growing population here in West Essex, an ageing population.
There's a finite level of resources, and how can we all make it work better?
Because the demands are so high on the NHS, if we don't change the way that we interact with the services that we have, we may well push them over the edge.
People really do need to value that service. It's unimaginable for me to have a UK without an NHS.
We should all be cautious with how much we use it, using it wisely.
We need to treat the NHS with care, and the way we should be doing that is by treating ourselves a little bit with care as well.
We do have some members of the public who will call an ambulance for a toothache, which obviously is completely inappropriate.
The message is that people need to have some responsibility now. I think the message probably has got through gradually that it's about partnership working.
The most rewarding part of this job is when you've been involved in bringing to life an idea of GPs or nurses or therapists who said, if only we could operate the services like this.
I've seen the lowest level of support worker hold someone's hand for over 3 hours because they had dementia and were upset and were screaming and worried, and they just stroked their hand. And 3 hours later, when I walked back in to leave, she was still stroking that man's hand.
The doctors are trying really hard to do everything they can.
My hopes for the future is that we get it right for our population and we make them live better lives and healthier lives.
To make a change, to actually see that change through and see what a difference it is making in terms of patient access, patient satisfaction and delivery of services to patients.
We need to make sure our elderly are well cared for and that young people have actually got every opportunity to live a full and healthy life.
Life without the NHS would be, am I allowed to swear?
From a personal point of view, I think in this country we've got something really special, and that is the NHS. And that's something that I want to be part of, and it's something that I want to help deliver on a day in, day out basis.